Happy day children! Welcome back to our next video on lesson 3 Safety and First Aid. First aid for burns. Burns are injuries caused by fire, hot objects, boiling water, steam, firecrackers and some chemicals such as acids. Burns can be minor or serious and it is classified as first degree, second degree or third degree burns. Only very minor burns can be treated at home. A minor burn causes redness of the skin. No blisters are formed. A blister is a bubble formed on the skin due to damage. The first thing to do is to immediately wash the area with lots of cool water for several minutes. If the pain continues, apply a damp cloth over the burn. In more severe burns, the skin becomes red and blisters form. Immerse the burnt area in running cool water for 10 to 15 minutes. Do not allow the blisters to break because they can get infected. If the blisters do break, wash the area with mild soap and water and apply antibiotic cream and cover with a loose bandage. In case of very severe burns, rush the patient to the hospital. First aid for nosebleeds. Nosebleeds are very common and sometimes can stop on their own. However, a few safety tips can come handy. Make the person sit up straight and lean slightly forward. Hold and pinch the soft portion of the nose carefully for at least 5 minutes to stop bleeding. First aid for animal bites. The bites of animals such as dogs, monkeys, cats and bats can be dangerous. The mouths of all animals contain germs and the saliva can cause infection. The bites of some animals such as dogs, bats and so on can lead to infection with a serious disease called rabies. Wash the bitten area well with soap and water. This will wash off the saliva. Call the doctor. Injections to prevent rabies may be necessary. If a venomous snake such as cobra bites a person, the venom spreads through the blood. Since movement will cause the venom to spread, try not to move the person too much. Keep the bitten part of the body in a lower position than the heart. Treat the snake bite like a fracture. If the bite is on a limb, make sure that the limb is not moved. Take the patient to a hospital as soon as possible. And before taking him to the hospital, tie a band-aid above the point of snake bite. This prevents the poison from spreading throughout the body. In case of insect bites, wash the affected area with cool water and soap. You can also use an ice pack to bring down the swelling. For bee stings, apply a paste of baking soda or toothpaste. For wasp stings, apply vinegar or lemon juice. Children, we have learned the basic first aid tips for various injuries and accidents that may happen to anyone at any time. Whatever may be the situation, stay calm and give first aid for the injured person and keep them comfortable, as well as call for medical help. Thank you children. Bye.